So we've got a very interesting session this afternoon from the Faculty of Health. So first up is Thor Rigney. He's from the Faculty of Health and he's going to tell us about his research on the rate and reason for attrition from 5 allied health musculoskeletal healthcare workforces.
Very good.
Systematic review.
Well done.
Thank you.
So I'm Thor Rigney, and I'm going to share my latest piece of research that has taken me about 6 years to do. Things that I've reported here in the past have been happening while this is in the background. So I'm going to not only share with you what I have as far as results, but also, in the spirit of what John said this morning, there's a bit of a journey, kind of like what Kennedy was saying today. So I'm going to be a little bit vulnerable, so share some personal aspects about my journey, and hopefully you'll all get something from it. So in the spirit of respect, reconciliation, and responsibility, I want to acknowledge the traditional custodians of this land which we are meeting, the elders past, present, and emerging, and any Aboriginal and Torres Strait Islander people who are with us today. I want to personally share my appreciation for the reminder that this Welcome to Country does. For me, it is a reminder of being, just a reminder of the blessings that's offered from nature and from community. And I really think it's a cool tradition that happens here. I've not seen it in Canada, and I've not seen it in the US. So I think it's a beautiful tradition, and I support it 100%. So in the spirit of gratitude, I would like to express my gratitude to my supervisors and Professor Sandra Grace and Dr. Joanne, she goes by Jo Bradbury. I want to thank the committee of the Southern Cross Postgraduate Association and the staff for making this opportunity possible and for their support throughout the process and through my journey, and also to thank the University HDR for making this all happen. But most importantly, I want to thank all of you for sticking it out and being here today, and not just the people who are presenting after me. So I really appreciate that. Thank you. So let's see. Before I go into this, I'm just going to back up for a second. Everyone talks about the journey of postgrad and the research, and it is hard. It's hard work. But no one really prepared me for the psychological journey that it is and the emotional journey. I thought it was just going to be hard. I was used to hard. I could do hard. The hardest thing I did in school was organic chemistry. That was hard, the second year. And so I thought if I could do organic chemistry, I'm unstoppable. But there's a certain aspect. I'm one of those online people, and I'm in Sydney, so I'm far from people who can relate to what I'm going through. So that's one of the biggest reasons why the Postgrad Association is so important to me, because of this top line here, engagement. It gives me an opportunity to be with people who are sharing in this journey. And I have to also thank my supervisors for being sensitive to my process, because feedback, I wish I had your training, Josie, because I was crushed by feedback, especially when I had a paper reviewed and it came back. Wasn't rejected, so I should be happy, but it was still painful. But my supervisors kind of walked me through it, and so thanks to their wisdom. But the process is more than just putting your head in the book and writing and whatever, studying and figuring out what narrative synthesis is and what, all this different, you see it as a item on a slide, and researchers will know that each item on the slide took a lot of effort to understand and appreciate that. So, but it just looks like a bullet point. But especially for me, I was just saying during the break that I am a slow process. My mind is not very quick, and I've learned how my particular brain works as far as what it takes to learn. It's a little bit, neurodiversity working in there, so it's a bit complex, and it takes a little bit more time for me to understand and appreciate. So I'm a bit slow, and it just takes that much more time. Thank God I'm doing this part-time, which is why I'm here every year for so long. And I finally made it to secretary. Yeah, okay, so I just wanted to share that, and also express the value that the Postgrad Association gives. It, all the academic support is fabulous, but what I love is praxis and then the community that it offers. It's a great, beautiful thing. Okay, so we heard that there's a shortage of teachers out there, and in 2050 there's going to be 9+ billion people. So there's all these increasing populations and a shortage of workers, and so that is also true with healthcare. There is currently a shortage of healthcare workers worldwide, globally, and it's projected to continue as a shortage into 2030. That's just as far as when they did their modeling. So, there's no indication that it's going to change. I just wanted to highlight that this information comes out with a focus on allopathic medicine, allopathic doctors, and nurses, and pharmacists. It doesn't touch all of healthcare workers. So along the lines with this shortage is this continuation of musculoskeletal disorders are the primary reason for disability globally, and cost individuals and governments billions of dollars for the diagnosis, the therapy, the treatment, and work loss. So it's a lot of money. So to determine how much, what the workforce is, the healthcare workforce, you have to know how many people are in it now, how many people are projected to enter it, and how many people are leaving it, attrition. So my research is on attrition. My end result is attrition from the chiropractic profession, but my research here, the review, is attrition from 5 musculoskeletal healthcare professions, because I just mentioned how important musculoskeletal dysfunctions are, disorders. So I looked at, this is alphabetical order, chiropractic, I got a better look, exercise physiology, physiotherapy, podiatry, and osteopathy. So, and it's interesting to me that when this was suggested to me, I didn't realize that most of those programs are offered here. Yeah. So, all the way up chiropractic. So I'm thinking, maybe there was a different rationale for including all 5 of, all of them. But it was definitely worthwhile. So I wanted to find out what is the attrition, the rate and reason for those 5 musculoskeletal healthcare professions. So I looked through 5 different databases, and I used multiple keywords. And instead of PICO is a common one in the healthcare arena, but I used Coco Pop, mostly because I just love that acronym. but it's because it's the condition, the context, and the population, so it actually fit what I was doing. And I also did a concept analysis on attrition to try to capture as many of the synonyms as I could for the search. And so what was included were original studies on attrition from the musculoskeletal professions that were peer-reviewed. And what was not included were studies that were attrition from students that were studying in these schools or in these programs, patients who were involved in control RCTs, randomized controlled trials, and then also any profession that wasn't in the 5, so like midwifery was not included, that type of thing. And studies that were solely focused on burnout were also excluded. That's a whole nother, it might be related, but it's a different aspect. And then, of course, opinion papers, commentary, and basic gray literature was not included. And the process of the selection was your typical rigor, with 2 people assessing the possibility of inclusion and exclusion, and doing it blindly, and then if there was any conflicts, then a 3rd person, and there was a discussion with all 3 of us to determine if it was included or excluded. So we were going to appraise the quality of each of the included studies, and it was decided to have a blend of two different known instruments. One was AXIS, which assesses or appraises cross-sectional studies, which most prevalence studies are cross-sectional, and the issue with that was that the results of that analysis were subjective, and it made it more difficult to have a reliability among different evaluators. And so to improve that reliability between different evaluators, there was a blending of AMSTAR 2, which is for systematic reviews. And what this instrument does is it gives a rating as far as the quality being critically low, medium, or moderate, and high quality. And it was based on the number of critical errors or major problems within the study. So to do this, AXIS has 10 items that are measured, and we had to determine which of those 20 items were critical, and we decided that 5 of them would be critical, and that they were based on risk of bias. So if there was a risk of bias, that was considered a critical fault. So we did. We blended the two, and then we piloted the new process, and then we adjusted accordingly to those results. 10 items were extracted from each of the would be extracted from each of the included studies, and it was oh my goodness, it was decided to do the descriptive statistics and narrative synthesis. So there were over 1,000 papers. It boiled down to 6, and 3 of them were chiropractic, 2 physiotherapy, 1 osteopathic. The attrition was reported to be 4 to 8 for the chiros, the Canadian chiros and the physios, but 10 to 25 for the California chiros. The thing is that these attrition weren't necessarily attrition from the profession. It was more like attrition from regional licenses. So it wasn't true attrition. And then the reasons for attrition were multifactorial. Some papers focused on finance, but there were other aspects to it. And so most of the studies were critically low. One study was moderate, because even though it still had multiple non-critical faults. And they were old, a lack of transparency, and but some of those that looked into data searched many years of data, and the surveys explored more than just finance. So I was the only one who did the actual search. That apparently is no longer appropriate. You need two people searching blindly. That's a new thing. I took so long to do this review that I'm doing a third search because it's so old. I have to do another search. So, but in the meantime, a systematic review and what's expected has also changed. So I'm like having to try to catch up. But anyway, so you have the results there. We need to get the, when future research needs a very clear definition of what attrition is. You need to determine if the attrition is regional or if it's professional, and then to figure out the rate and the reason it should be a mixed method approach. So there we go. Thank you so much.
Thanks, Thor.
You're welcome.
Fascinating study, and you sort of had to race through the end there, but it was a very heartfelt start, so thanks. Comments and questions for Thor, yes?
Thank you for your wonderful presentation. I have just a couple of issues to address here. That means, did you register with Prospero before doing this systematic review? And another point is that actually, did you use any second coder for coding your result? Your data.
Did a second coder?
Yeah.
Yeah. Okay. You mean for the data extraction?
Yeah.
Yeah. So yes, it was registered with Prospero, and what I did was I did the data extraction, and then a second person verified it.
Any other comments and questions for Thor? Yeah, Erin.
Thank you.
Thank you so much, Thor. That was a really great presentation. Really beautifully put together on the slides too. I always appreciate that. I just wanted to know, so in the end you ended up getting 6 papers for review and 2 of the disciplines weren't presented in that. Was that surprising to you?
Yes.
Or were you kind of going into it knowing that there was a paucity of evidence?
Thank you for the question. I wasn't surprised of the paucity. I presented earlier on the chiropractic alone, and I searched even 30 years. This was more like 20, but now it's like 25. But and so so I knew that it was likely that there wasn't going to be much, and so. But I was surprised, especially with podiatry, that there would be 0. And so that I was surprised, and I really didn't have any expectations for exercise physiology because that discipline is kind of new to me. I'm not familiar so much with it, and so I had no expectations for that.
Sure.
So when you were doing the analysis of those papers, did you, I'm not sure if you've done many reviews before, but do you think that having less resources kind of allowed you to really get in and do really deep thematic analysis, or did you feel like you were kind of wanting a little bit more? Do you think it made it easier or harder, I guess, having 6 papers to work from?
I think I'm fairly grateful for the paucity. And I've read those papers so many times. I told you already that I'm slow, and each exposure I got more because, to be honest, there was so much bias in me that I was reading things into what I was reading, and when I read it again, I'm like, well, I thought what happened to that other thing that I was thinking? And so it changed because as I increased the exposure of it, the biases were dropping, and then I would have a question like, well, what about this? And instead of just like glossing over it, I would dive further into it, and so I'm grateful for this time span because I've learned a lot, and that's really my whole thing about this PhD journey is not only what I'm learning as far as the research methodology and all that, but what I'm learning about myself, and these unconscious biases that I'm holding, and so kind of picking all that apart. So I found that the fewer number probably enabled me to get beyond all of those, and so I'm grateful for that.
I had a similar result myself, so that's why I was just wondering. I found it really beneficial to have less and be able to go in really deep. And as a new researcher, I was thankful for it.
Yeah. Well, I'm new to qualitative. My background is more quantitative. So that whole aspect, and my being is more in line with qualitative. So I'm really enjoying that aspect of it.
Okay, thanks so much, Thor.
Thanks.
That was excellent. Thank you.